So I'll start by saying we're extremely early, but also say that unlike some other folks, I don't think that AI is going to replace all doctors and whatnot. Someone had a quote, I forget who it was, but it's not that AI is going to replace doctors, it's that doctors who understand AI and know how to use it are going to replace those that don't. So I think we're very early in the game because healthcare is slow. There are these regulatory and privacy challenges, there are differences in patient populations. you know, Self-driving cars, this is why I'm not driving in one on my way home today, too. It's not easy to navigate the streets of Boston, even if you can drive around, a highway in Arizona. And those sorts of problems are ubiquitous in healthcare. You train an algorithm that can identify tuberculosis in, Chinese patients. You bring that to Miami where no one really has tuberculosis and the algorithm gives you a bunch of random noise and it's not very trustworthy. And then doctors learn not to trust these algorithms. So I think that we're early in general in terms of the impact that AI is going to have across industries, and we're especially early in the healthcare industry.